So, so I'd like to go on and deal with this question of what does the movement system pertain to? So we'll show some slides and graphics to get that information clear in this presentation. As I mentioned, I want to clarify that the movement system does not just pertain to the musculoskeletal system, and it doesn't just pertain to chronic conditions, but also to acute ones. Didn't mean to do that. So it was in 2013 that the American Physical Therapy Association adopted this identity of the movement system. And the reason for that is to emphasize that physiotherapists have a responsibility for a body system. Now, it's not one of the basic systems like the musculoskeletal, but it is a system of systems. My own thinking about this started almost 50 years ago when I was part of a panel and was being interviewed about what physical therapy is. I was a chapter president, and happily they asked another chapter president to describe physical therapy before me, and he gave a really bad answer. But I was so befuddled, I didn't even know what I was going to say when it was my turn to explain it. And so then I wanted to say more than we helped paralyzed people be able to move. I thought we needed to have a body of knowledge that would make more sense. And it just became clear over the years that what we really care about the most is movement, making sure that people can move as optimally as possible and as pain-free as possible. And the reason for taking it on to say movement system is the way we make people move better is to attend to try to deal with how the muscles function, how the nervous system functions, all of those things that produce and affect movement. And over the years, what I've watched us emphasize as a profession is our treatment techniques. So we're known more for what we do as far as treatment, but it doesn't mean that we're respected for what we know. It's more like the doctor figures out what's wrong and we deliver up the therapy. And so what became really clear to me is that the physicians, for the most part, and I was in the Department of Neurology for about 40 years, is they don't understand the complexity of movement. The neurologists knew about what was wrong with the nervous system. So it is clear we need to be respected for what we know, not just what we do. And then if you want to pick a system to be responsible for, the movement system is a really great one because it's essential at all levels of function of the organism. So whether it's ions going through membranes, air going through lungs, how you move your limbs, or how you move in your environment, it's all about movement. So the definition of the movement system adopted by the Physical Therapy Association this past year says it's the integration of body systems that generate and maintain movement at all levels of bodily function. So it's very broad and very general on purpose. So this is the graphic of the American Physical Therapy Association. And what it shows you is that the movement system is not limited to just the musculoskeletal or nervous systems, but you can incorporate the metabolic system, the genital urinary, the gastrointestinal, and even the immune system. It also fits nicely with the biopsychosocial aspects that people are so focused on these days, because for bio, that's all of these systems. They're all physiological systems. And psychosocial, you can't have that functioning without the nervous system primarily. And the pain, like we talked about earlier, is also I don't know, that one went away, is also an important part of the nervous system. There's no pain without the nervous system. But you have to say to yourself, as a physiotherapist, with all of these systems functioning, what do we care about in particular? And it's the movement associated with these systems. And even with the immune system, which, as we know these days, almost every condition that physicians are worrying about is related to the immune system. And the most important intervention for treating the immune system, one of the important ones for lifestyle, is exercise. And I just want to go on to say to show you a paper. This is in an article I was reading, that how to save your immune system. And they specifically cite movement and regular workouts boost immune function and lower inflammation. The article cites how skeletal muscle is the major immune regulatory organ, and that it generates the anti-inflammatory and immunoprotective protein called myokinase. And physiotherapists should be the exercise experts. It's not just telling people to exercise, but what can they do safely? What can they do effectively? What's appropriate for them, considering structural variations? And so again, just to make the point, why the movement system? Well, because we're focused on the movement system and we should be exercise experts. And I think this speaks to the knowledge we have, because for the musculoskeletal system, it's about the biomechanics, the muscle physiology, and skeletal physiology. And for the nervous system, it speaks to the biocontrol, biobehavioral, the psychosocial aspects, and even biomechanics, because the activation patterns of the nervous system are really the interaction of muscle and motor learning. And of course, gravity is a major influence. And then we have the bioenergetics that arise from the cardiovascular, pulmonary, and endocrine systems. And those are the support systems, but they're also affected by movement. So that's why it's important to have all of these systems as part of our expertise, so we know what affects movement and how best to optimize it. And it's important to convey this responsibility for a body system, a physiological body system. That's why neurologists, cardiologists, even dentists have respect, because they're in charge of a body system. And then I want to emphasize, last time I was making a point about kinesiopathologic conditions, how movement induces pathology, but clearly, this is where we started, pathology induces faulty movement. So this has always been our responsibility, is if you have a stroke, if you have rheumatoid arthritis, your movement system is affected and you will not be moving right. And then again, the nice thing about being responsible for the movement system is we can have a very big role in prevention. I think most people understand how important it is to be physically active when you're young, so you develop as much bone density as possible, so that you also have an optimal cardiovascular system. But beside knowing that you need to exercise, you also need someone that can tell you how to do that without getting hurt, without injuring yourself, so you can have it a lifetime instead of for a short time.